Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Well, it's winter, and if you woke up in Minnesota this morning, it wasn't too hard to figure that out. Well, there are a lot of things that can happen this time of year that can cause people to end up in the emergency room. Carbon monoxide poisoning, skiing and snowboarding accidents.
Oh, frostbite, hypothermia, heart attacks, and back pain while shoveling that white stuff.
And fingers caught in a snowblower.
Oh my gosh. Here to talk about winter emergencies is Mayo Clinic emergency room physician, Dr. Susan Cullinan. Welcome to the program.
Thank you. Thanks for having me.
For being here, Dr. Cullinan. And let's start with carbon monoxide poisoning, because we occasionally hear of a case, but you sent some figures, 50,000 people treated for that every year, and 400 people die?
Correct. 400 people. And that is a lot of people that I think we don't think about that being that big of an emergency. It's an invisible gas, odorless, colorless, so you often don't even know it's there and you're being exposed to it. The symptoms, are so common, similar to other things like viruses. You start with a headache, you don't feel well. So they're very similar, so you might not even be aware that you're being poisoned with carbon monoxide.
And is it mostly a bad furnace or a bad water heater, or how do most of cases happen?
Most times it is furnaces. You turn them on in the winter, you haven't had them serviced maybe or checked, and you don't even realize. And maybe your carbon monoxide detectors aren't up to par or haven't been checked, or you don't even have one. And so those are the kind of things that lead to poisoning that are just people aren't ready for.
This isn't even winter only. Lots of times you'll hear stories when there's been a hurricane or a tornado and people don't have power that they'll get carbon monoxide poisoning because of their because they're on alternate power.
Right. Or they'll bring furnaces or grills or heaters in that aren't supposed to be in the house, and they become exposed to carbon monoxide. And then we'll pick it up sometimes if the whole family comes in with headaches or nausea. Sometimes it's that easy, but we've had patients who've come in with stroke-like symptoms, and you think they're having a stroke, and then as you work them up, you realize that it's more than that, and it's carbon monoxide poisoning. So,
and how do you confirm that?
We do testing. There is a blood test you can do, and your carbon monoxide levels. If you're a smoker, your carbon monoxide levels are still going to be kind of around the 5 level and even up to 10 sometimes. So they have a higher level just by being a smoker. But the normal person should be less than 5, or I should say the non-smoker should be less than 5 when we do a carbon monoxide level. And when people start showing symptoms, often they're over 10 and 20 on the blood tests.
And what about when the carbon monoxide detector goes off?
Right. Some people blow it off. They don't. They don't pay attention to the carbon monoxide detector, or they think it's it needs a new battery or something, and they don't do all the things they're supposed to do. But really, you should get it checked. You should leave the house. You should bring everybody outside or to a different place with you, and you should call 911 and have the fire department come over and check the levels, because that's the only way you're going to really know if the levels are high in your house or not.
And how often do you see this, actually? Mostly in the winter, I assume. And then what do you do if you do make the diagnosis?
We just recently had one in Northwest Wisconsin up in the emergency department where we diagnosed a patient with carbon monoxide poisoning. We got the fire department involved. There was a big news story on it. I read it in the paper, and I was very impressed that our staff was able to pick this up and get help, and we're able to save one of the pets in the house and go over, and it was a faulty furnace. So this is...
but there's nothing you can do, really, is just let the...
For the patient?
Yeah.
For the patient, you would put them on oxygen, and they will start clearing after so many hours. It depends on how high the level is. Sometimes they need hyperbaric oxygenation, too, to correct their symptoms. They can be that sick and that ill.
And at what level is it where it causes you death?
Greater than 30 usually causes death, and they start getting different symptoms where they get lose coordination. They're very confused. They can have a loss of consciousness. If they come in unresponsive, usually they'll need hyperbaric oxygenation.
And have no idea what the problem is.
Sometimes they don't.
Yeah. Incredible.
Let's talk about frostbite.
All right. That happens a lot too.
Yeah. What are the symptoms of frostbite, and what is happening?
Usually the symptoms, your fingers are getting very tingly and red to start with. And what's happening is the tissue is actually freezing. So the tissue and the skin are starting to freeze. And symptoms start building with the redness of the skin, and it can eventually get white and hard and waxy and blistery. So it goes through stages. And it's just catching it at those initial stages and getting it covered up and getting back into a warm place. That's the appropriate thing to do.
And what about rewarming? Is rapid rewarming the wrong thing to do? Hot water wrong?
Right. Well, I think it'd be very painful to stick your fingers in super hot water. And the appropriate thing is just getting it covered with something warm. Warm blankets are just the best way. And getting inside in general, and your body will naturally just all warm it up too. So yes, you don't want to put them right in hot water.
We see cases where the tissue actually dies and they end up with amputation of their toes or fingers.
Correct.
Not that all that uncommon.
Not that uncommon. And even fingertips, tips of ears, tips of the nose, those are the most exposed and most common to get frostbite.
What's hypothermia?
Hypothermia is when you've been out in the cold for so long that your body temperature drops below 35 degrees Celsius. Have very similar symptoms to when we were talking about carbon monoxide. You start slowing down, you start getting confused, your coordination's off, you don't make the best decisions, and eventually your breathing slows down, your heart rate slows down, and you can die. So it's very serious.
Snow shoveling. I bet you see probably more injuries, heart attacks, isn't it? Mostly heart attacks from snow shoveling is one of the most common things that you see.
It's said about 1,000 injuries a year with snow shoveling, but 100 deaths a year with shoveling. The American Heart Association just does not recommend it if you have a heart history at all. They'd say just don't even, it's not worth a clear driveway to risk your heart. So we do see it. We'll get the 7 a.m. shovelers before work, and then they come in with chest pain and pressure and shortness of breath. And sometimes that's their first clue that they do have heart problems.
So you said if you have a heart disease history, you shouldn't pick up the shovel.
You shouldn't pick up the
shovel. You should have your spouse do that.
Yeah. Maybe hire the neighbor boy for
hire
give him a job. There you go.
Wow. And snowblower safety. I don't like this part.
I know. This one, and it happens every year. People dig out that clog and they lose a finger or part of their hand. And even when the snowblower is off, you still have a chance when you remove the clog of snow that the blades can release and you can get injuries. So it happens every year.
Our listeners in the southern part of the country are going snowblowers. What the heck? That doesn't make any sense. But falling, even a little bit of snow can cause slippery situations. So a lot of people are hurt every year when they fall because of the ice.
Right. Thousands of injuries with falls. And we see it more in the elderly, but we see it in everybody. We see it in the young kids skiing and they have the skier's thumb. We see it in the kids that fall and hit their head and get concussions. But the elderly are at more risk for when they fall, they just don't get back up right away. They have wrist injuries and they have hip injuries. And that leads to long recovery periods. So if you cannot go outside, that's just the best advice to avoid that icy
What about when you do fall? Because when middle-aged people fall, younger people fall, we jump right back up to make sure that nobody saw us fall. Is that a dumb thing to do? Should we kind of just sit up and then take stock to make sure we're okay before we jump up?
Probably, but I think you will know too, and I think, sometimes the older people are aware they can fall and they have their walker and they have their cane and they're using the railing. I think our middle-aged group, of which I'm part of, we don't expect to fall, so we're not using those devices or assistive devices, and we just get out and go, and we're checking our phone as we're walking, and that's not always the best because you're just more prone to slip.
All right, skier's thumb, by the way, it's where you rupture the ligament on the inside of the base of your thumb. It can happen skiing. It happens in football players. Very common injury.
Very common, and people just get a sore, swollen thumb, and they don't realize that it usually requires surgery for that ulnar collateral ligament to get reattached. Wow, exactly. Someone talks like he knows about it, like he's maybe had it done.
Well, I haven't had it. Wintertime is a busy time for a lot of emergencies around the country, and we've just heard about some of the most common reasons that people end up in the emergency room this time of year. And remember, like my old scrub nurse used to say, safety never takes a vacation, even in the wintertime.
Our thanks to Mayo Clinic Emergency Room Physician, Dr. Susan Cullinan. Thank you.
Thank you.